Hello, today I will be talking to you about heart disease. The setting will be at the Go Red Health Fair, and the target group will be ages 40 through 65. By the end of this lesson, individuals will be able to understand the important actions that they need to take to help prevent heart disease. They will also be able to explain the risk factors associated with it, and they will also see which lifestyle choices they would need to take in order to start a healthier lifestyle. First, we will begin by discussing what is heart disease. Heart disease, also known as cardiovascular disease, is when the heart and blood vessels includes numerous problems, many of which are related to a process called atherosclerosis. Atherosclerosis is a condition that develops when a substance called plaque builds up in the walls of the arteries. This buildup narrows the arteries, making it harder for blood to flow through. If a blood clot forms, it can stop the blood flow. This can cause a heart attack or a stroke. Heart disease is not due to a deficiency of drugs. Heart disease is caused by processed foods and sometimes can be considered a modern man's disease. The risk factors associated with heart disease include age. With age increases your risk of damage to narrowed arteries and weakened or thickened heart muscles. Sex. Men are generally at greater risk of heart disease. However, women's risk increases after menopause. Family history. A family history of heart disease increases your risk of coronary artery disease, especially if a parent developed it at an early age. Smoking. Nicotine constricts your blood vessels, and carbon monoxide can damage their inner lining, making them more susceptible to atherosclerosis. Poor diet. A diet that's high in fat, salt, sugar, and cholesterol can contribute to the development of heart disease. High blood pressure. Uncontrolled high blood pressure can result in hardening and thickening of your arteries, narrowing the vessels through which blood flows. Diabetes. Diabetes increases your risk of heart disease. Both conditions share similar risk factors such as obesity and high blood pressure. Physical inactivity. Lack of exercise also is associated with many forms of heart disease and some of its other risk factors as well. Stress. Unrelieved stress